Well, the flu is going around. Lots of people are sick and lots of people are trying their best to get well. Dr. Shelley Lee is here with the Austin Diagnostic Clinic to tell us more about how to avoid the flu and if you have it, how to get through it. Thank you so much for being here.
Happy to be here.
Sure. Talk about the symptoms. I think we all know what the symptoms are of the flu. You're achy, you just don't feel well. So talk a little bit more about.
Right, exactly. So typical flu symptoms include cough, sore throat, congestion, runny nose, usually fever, body aches, and just a feeling of being really tired.
Yeah. And is it a worse season this year? Because it seems like people were urged to get the flu shot and they got the flu shot and still ended up getting sick.
You know, the flu shot unfortunately isn't 100% effective for everyone. This flu season actually hasn't been as bad as the previous flu season. I think the reason for this is because most people were vaccinated earlier this year.
That's good.
So, but unfortunately, it is possible to still get the flu with the flu shot.
Really? Well, so what else can you do to avoid getting it?
Well, definitely practice good hygiene. So you want to be washing your hands frequently. Anytime you are coughing or sneezing, make sure that you are covering your nose and mouth. And also, if you're sick or if you know another person is sick, try to avoid contact with sick people. Or if you're sick yourself, try not to be around other people.
So stay home, basically.
Yes, exactly.
Just talk about the importance of making sure you eat healthy, too, because that's part of staying well.
Right. So diet and exercise is definitely important. So make sure you're getting your nutrition from the 4 basic food groups, plenty of fluids to stay hydrated, and then we always recommend moderate exercise most days of the week.
How debilitating can the flu be?
Generally, most healthy people can recover from the flu typically in about a week or so. So it's really not a big deal for most people. There are certain groups of people where the flu can be very serious. Those groups include the very young, the elderly, pregnant women, people with chronic illnesses like diabetes, asthma, COPD, anybody with a weakened immune system. So those people are definitely at risk for flu complications, and those groups we strongly urge to get the vaccine.
Now, if you do get sick and get the flu, is there anything you can take to get rid of it, or do you just have to let it run its course?
Well, there are 2 commonly prescribed flu medicines out there, the Tamiflu and the Relenza. Those 2 medications are usually taken within the first 48 hours when your symptoms first start, and they generally help to reduce the severity of your symptoms and shorten the duration of the flu. And then, of course, getting plenty of rest and plenty of fluids.
Excellent. Well, if you need to make an appointment, if you are sick, you can see Dr. Lee by making an appointment. You can call 460-3043 or make an appointment at adclinic.com. Thank you so much for being here.
Thank you.